Hello, my name is Dr. Yoshihiro Katsuura, and I'm a board-certified orthopedic spine surgeon practicing in Northern California. Today, I'd like to talk about exercises for preventing and treating low back pain. This is a video that I've been really excited to make and have been meaning to make for a long time, and I think will be valuable for a lot of different patients. Why do I think this is so important and valuable? Well, it's because low back pain is extremely common. A lot of my patients are faced with it and don't really know how to deal with it. If you've watched some of my previous videos, you'll know that muscular strain is the most common reason for people to develop low back pain, and it's easily treated with exercise, which can help not only prevent further injury, but heal your actual muscle strain. But why is exercise good for the low back, you may ask? One really important reason is that the discs actually absorb their nutrients through motion. They wouldn't get the adequate nutrition if it weren't for this motion. The second reason is that the muscles that surround the spine are incredibly important for its stability, and so keeping these quote-unquote core muscles strong is extremely important. Finally, weight bearing and load bearing is incredibly important for the overall strength of the bones. If you don't bear weight, the bones quickly become osteopenic and brittle, and that can predispose you to osteoporosis later in life. Very painful condition. So before we get into the actual exercises, we need to talk about a couple of ground rules. The first is that if you're experiencing low back pain, please be evaluated by a physician so you have a diagnosis and you know what you're actually dealing with. It's likely a muscular strain, but let's confirm that before we dive into an aggressive exercise program. The second thing you need to keep in mind is that everyone's different. You cannot go too hard or too fast initially. You have to exercise common sense when doing these exercises and pick a speed that's going to work for you. If the exercises hurt or cause pain, you need to stop them or modify the exercise. It's not meant to be painful. And if you lack any experience doing exercises and this is your first time trying out these things, consult a trainer or physical therapist before you get started. It's a great way to learn the right way to do it and prevent injury. So let's jump into it and discuss what goes into a low back exercise program. I believe that there are three key components to having a low back exercise program. The first is cardiovascular conditioning, the second is flexibility of the back and the extremities, and the third is core strength, and we'll go through each of these in turn. Let's start with endurance. This is really simple. The only exercise you really need to do is walking. Walking is very safe, it's really good for your low back, and it's easily modified to increase the intensity. In general, you want to walk about 30 to 60 minutes, 5 days a week. You want it to be at a brisk pace so your heart rate gets up at least above 120. An easy way to accomplish this is to incorporate a slope or some stairs into your walking program. There are, however, a couple of rules if you want to use walking as part of your low back exercise program. The first is that you need to brace your abdomen. So an easy way to accomplish this is to think about walking around as if someone's going to jump out from the corner and punch you in the stomach, so you're always ready and you're keeping your core very tight. The second is you do not want to be looking down at your feet. You want to keep your posture really good, head up, shoulders back. This way you maintain a neutral spine alignment and don't do anything that's going to cause injury. Okay, next I'm going to talk about flexibility. It gets a little bit more complicated with flexibility, but there's a couple of ground rules that we need to go over. First is that I'm going to show you a series of stretches. Each stretch should be done approximately 4 or 5 times. When you do the stretch, it's okay to hold it for 1 or 2 whole breaths. Make sure you're breathing really deeply and allow the stretch to sink in. It's best to do each stretch in a very controlled and conscious fashion, meaning that you're paying attention to what your body's doing, you're not jerking, forcing, you're not swinging your back or doing something awkward to try to achieve a position that your body cannot handle. So do it very carefully and think about what you're doing first. Remember, avoid injury. And try not to do these stretches the first thing in the morning. After you've been lying down, your discs may become dehydrated, making them slightly more prone to injury. It's better to warm up a little bit, go for your walk first, then do your stretches. We're going to go through a number of exercises, but I'm going to list them out right here. The first is a single knee stretch, second is hamstring stretch, then we're going to do a tensor quadratus stretch, moving into the gluteal or piriformis stretch, a quadricep stretch, abdominal stretch, cat and camels, which you may be familiar with, and finally a knee and pelvis rocker stretch. The first exercise is the single knee stretch. What you do is lie supine. You bring one knee to your chest and pull it close to your chest with your arms, hold it, take a deep breath, and then alternate to the other side. The second is the hamstring stretch. Again, lying supine, you can bring your knee into your chest, hold the back of your knee, and then extend the knee to stretch the hamstring. Hold it for a breath or two, let the knee down, switch to the other side. Next is the tensor or a quadratus stretch. Lying on your back, bring your knee to your chest and let it cross over your body to the other side, and then extend your leg if you can. Take a deep breath and hold this position and allow the stretch to sink in. Then pull your knee back towards your chest and relax, and then do the other side. The gluteal or piriformis stretch is meant to stretch out your buttocks, so lying on your back, bring your knees in towards your chest and then cross one ankle over the other knee and then hug that knee towards your chest, which rotates your hip and your buttocks. Hold this for a second, untwist yourself, relax, and then do the other side. The knee rocker stretch is one of my favorites and is really good for low back pain. Lying on your back, slide your knees up so your ankles are closer to your buttocks, and let the knees rock gently from side to side. You can hold it on one side, take a deep breath, and then go to the other side, and then just keep doing this motion. It feels great. The quad stretch is really easy. Lying on your side, pull your knee close to your buttocks, hold it in with your arm and get a really good stretch through the thigh, then relax, repeat on the other side. Cat and camels you might be familiar with. It's really common in yoga class. What you do is sitting on all fours, just gently arch your back and then let it slump back. The arch position is so-called camel position, and then once you let your back slump, that's the cat position. The rectus stretch or the abdominal stretch is also really good. Lying on your stomach, gently push yourself up so your torso is arching, and that stretches out the anterior abdominal musculature. I just wanted to briefly mention foam rolling. There's a lot of ways to get fancy with this, so I don't want to confuse anybody, but it basically just revolves around getting a cylindrical foam roller, and you can roll out various muscles. There's a lot of good instruction on the internet about how to do this, and if you can't figure it out, you can get a physical therapist to show you. I personally feel like it's really good for mobility and easing achy muscles. So now we're going to talk about the final component of the low back exercise program, which is core stability and strengthening. But first we have to understand what the core is. The core is a set of muscles that surround and stabilize the spine and can be thought of as a box. That's why we call it the core. There's a back, a roof, a floor, sides, and a front. You don't need to memorize this, but because I'm going to refer to them later, I thought I would show you some of the muscles. The first is the diaphragm, which is your breathing muscle, and that makes up the roof of the core. The second is the pelvic floor muscles. That's the floor. Now, in the back of the spine, you have the paraspinal muscles, which consist of the paraspinals and the multifidus muscle. Then you have the obliques, which wrap around the side. We're going to see those again in a second. The quadratus lumborum is a square-shaped muscle that attaches from your ribs to your spine to your pelvis. It's really important for core strength. In the front, we have the rectus abdominis, which are the abdominal muscles, and then here are those obliques wrapping around again. Those are the sides. The gluteals or the buttock muscles are also part of the core. Now that we have an idea of what the core is, we can start talking about strengthening and stabilizing the core. Any exercise program that works on the core focuses on building the strength of the core muscles. Again, control and coordination are more important than repetition. It doesn't make any sense to get out there and start doing reps that are uncontrolled. That's an easy way to hurt yourself. Most of these exercises are derived from very popular exercise programs such as Pilates and yogas, and I would encourage you to try a class in one of those disciplines. I'm going to go through each of these exercises, but I want to just list them out. There are Supermans, planks, bird dog, side planks, hip bridge, squat, and pelvic resets. Supermans are really simple. You lie on your stomach and you elevate your arms and your legs simultaneously, hold it, then release. For planks, you just elevate yourself onto your forearms and keep your back and legs really straight, holding it up. Hold it for 30 seconds and then release. You can try again. The bird dog exercise is so named because if you've ever been around a hunting dog, the exercise looks like when the dog does its pointing motion. So starting on all fours, elevate your back leg so it's straight, and the opposite side arm so it's also straight. Hold and then release. For side planks, lie on your side and elevate your body up so it's straight in line with your legs. Hold it and then release. Do the other side. For a hip bridge, lie on your back, bend your knees up, and then straighten out your pelvis and torso so they're in a line like a triangle. Hold that position and then release. Squats are really simple. Stand straight with your arms out in front of you. Brace your low back, keep it straight, and then gently squat down. Push yourself up. The pelvic reset exercise is a little bit complicated, but it can be really good for low back pain. Start with lying flat on your back, bring your knees up, and then with one arm pull in your leg and the other arm push away the other leg and almost brace yourself doing this position. Hold it for a couple of seconds and then switch and do it on the other side. Okay, that was a whirlwind. Just remember, this is a really basic sample of exercises. These are things that I have found useful for my own personal health. Be careful. Don't do more than you can handle. You can easily hurt yourself doing these exercises. If you don't know what you're doing, get help, take classes, and become a student of your own body, meaning read other books. There's a lot of great literature out there. Some of the books that I found particularly helpful for myself have been Back RX by Dr. Vad, Back Care Basics by Dr. Pulling, and a book called Supple Leopard by Dr. Starrett. If you like this video, you can subscribe. I'll probably do more videos talking about back and neck problems in the future.